When is back surgery appropriate for chronic pain? The difficult thing about chronic pain is that it keeps coming back. Its very persistent nature is what drives patients to brinks of desperation, and they'd be willing to try anything to get rid of it. Otherwise, they'll just have to learn how to live with the discomfort. Modern medicine offers various treatments for chronic pain. The range of treatment spans from medications, physical therapy, to, if needed, surgery. Depending on what the patient is open to trying and the severity of the pain, the recommended treatment may vary. It also depends on the depth of understanding the source of the chronic pain. While most cases reveal that the reasons are purely physical, there are also cases that reveal psychological conditioning as reasons for chronic pain. Depending on the diagnosis, appropriate treatment can be given by proper medical professionals handling the case. Usually, medication is the first recourse to treat chronic pain. The main purpose of medication is to offer relief from the symptom. However, getting used to medication can also form dependencies, and in cases wherein the patient has chronic pain due to psychological reasons, this method might just worsen the condition. Physical therapy is also another possible treatment to chronic pain. It's usually given to patients to help them prepare for other treatments, such as surgery if needed. It serves as a conditioning procedure that aids in either correction or recovery of preparation for treatment of chronic pain. In cases when neither medications nor physical therapy can alleviate the chronic pain, then surgery might be the best option. The patient should consult with the doctor for proper assessment. When does surgery become a viable option? There's no one right answer for this question, for the simple reason that the condition varies on a case-to-case basis. The viability of surgery as an option would depend on the professional opinion of the doctor. As a general rule, though, if there was one, surgery is an option when both medications and physical therapy can no longer address the pain, and if the pain has progressed to levels that has made the quality of life of the patient deteriorate. These are highly subjective, for the simple reason that the level of tolerance and idea of a quality life varies from person to person. Common surgical procedures performed to alleviate chronic pain are as follows: discectomy, fusion, and laminectomy. There are risks that can come from opting to go for surgery. There's the risk of nerve damage and nerve loss. While odds will vary depending on the cases, the worst case would be permanent damage. But in cases where the condition worsens, such as observed increase in pain rendering the person immobile, then a medical surgical care might be a viable option. Other options. There are also other emerging options that are less invasive. These integrative and holistic treatments take into consideration that the health of the patient is not just about their physical wellness, but emotional as well. Acupuncture uses ancient Chinese practices of regulating the qi, or energy in the body. Chronic pain is often one of the conditions that acupuncture addresses. Yoga is also an alternative.